So now that we've talked about the main classes of antidepressants, the next question comes in, what are some of our options after someone's tried their first antidepressant and it didn't work out for whatever reason, right? So there's a number of different things to take into consideration that can help optimize the options and give individuals the best chance to be successful with their treatment. So first off, big question that I always ask when someone comes in, if I start them on an antidepressant and they come back, 3 weeks, a month later, and they're like, it's not working. First question I ask, how much of it did you take? Did you take it? Because sometimes people will get that prescription, they'll go to the pharmacy and they'll become a little bit concerned or ambivalent, and they may not even start it. Or they take a dose or two and they didn't notice a benefit right away, which is to be expected, but maybe not if they weren't educated on that, and they'll stop taking it, right? So did you take it? How's the tolerability, right? Asking those kinds of questions. So once that has been sorted out and they're on an appropriate dose and they're taking it and not being successful, then we can think about, do we want to change the antidepressant? So you can actually change to a drug in the same class, which is kind of interesting. So even though, for example, Prozac or fluoxetine and sertraline or Zoloft are both SSRIs, people can have very, very different responses to those products, okay? We can also switch classes. So going from an SSRI to, say, an SNRI or an NDRI. So going from escitalopram to desvenlafaxine or escitalopram to bupropion. We could also augment, so adding another antidepressant. And there's a benefit to augmentation in that if someone had a partial response, if they did okay with it, like they're a little bit better, but they're not all the way, and they're tolerating it really well, there's a risk if we switch to another product that they will lose that benefit that they were able to obtain from that first product. So there is definitely a risk and benefit to think about that. There are other options that we can think about too that would not typically be a product that we would use by itself for treatment of depression, but can be added on to another antidepressant product to help essentially add on or augment that benefit. So lithium and mood stabilizers. Lithium is actually an excellent augmenter for depression. Tolerability challenges sometimes though. Thyroid hormone, so low doses of thyroid, even if someone is euthyroid, can be helpful, but you would have to monitor thyroid function. Psychostimulants can sometimes be helpful, especially if energy and focus and apathy are a part of the symptomatology. We can use atypical antipsychotics, and then there's some newer products that I'll briefly go over as well. So lots of options here, and it kind of just depends on the person. So antipsychotics that are used in depression. These, if you have access to schizophrenia information, the big picture stuff's going to be in there. But there are a number of products that are specifically approved as an augmenter for depression. So that means adding it on to a maintenance antidepressant. Products like aripiprazole, brexpiprazole, quetiapine, and then olanzapine, but only approved in combination with fluoxetine. There's actually a brand name called Symbyax. So these can be added on to help treat symptoms of depression. And which product is chosen depends on a lot of different factors, such as drug interactions, maybe genomics, if someone's had genomic testing, possibly their symptoms. So, for example, if someone has significant depression and difficulty sleeping is one of their challenges, I might add on quetiapine because of its sedating properties. And I wouldn't use it just for sleep, but adding that on can sometimes be helpful for people who are having a lot of hard time sleeping and need an additional medication to treat their depression. All right. So moving into other products, such as ketamine or esketamine. So this one's an interesting one. It's gained a lot of attention and was approved a few years back for treatment as an augmenter for severe depression. So severe depression, if it's failed 2 trials or more of antidepressants that were considered to be of adequate dose and duration. This product is interesting because it's a nasal spray. It actually comes as a device, you can see here, that has 2 sprays, and typically people are going to have multiple devices. Now, those devices don't ever get shipped directly to the patient. They actually get shipped to essentially a clinic, and the individual will get their esketamine at the clinic. It takes a couple hours, and they are monitored during that time. So they self-administer this nasal spray, and then they're monitored. So in addition to our general concerns about using antidepressants, we also need to think about the risk of abuse and sedation, dissociation with esketamine. These doses are low, so they don't have those full like or anesthesia doses that you would see if someone was, receiving it as part of a surgical procedure. But people will still experience some, kind of out of body types of symptoms when they are using esketamine. About 40% of individuals, so they have to be monitored. There's also some risk for blood pressure changes, so they have to monitor blood pressure. And people actually have to be registered, particularly the pharmacy and the individuals who are facilitating the administration are registered in a risk evaluation and mitigation program. So there's a number of different steps to ensure appropriate supply chain, etc. Now, ketamine is available as an infusion. It's not FDA approved for treatment of depression. However, there are clinics that are available throughout the country that will offer ketamine infusions for depression. And it's essentially going to be a cash pay sort of situation. So they won't get covered by insurance, but the actual cost of physical ketamine versus esketamine is a bit lower because the esketamine is a brand name newer product, and ketamine has been around for a very, very long time. So you will see availability of those types of clinics that can offer ketamine infusions as well. And again, these are usually going to be 2 to 3 times a week. We start at a higher frequency, titrate the dose, and then some people will end up on kind of like a maintenance frequency of the Spravato to help maintain their symptoms, because these tend to work kind of quickly but don't have as much durability, or they don't last as long. Thus the need for a daily antidepressant kind of underneath the Spravato.